No one likes to get a colonoscopy, but it's an important tool in the fight against colon cancer. But there is an easier way. Cologuard is a non-invasive, effective, and affordable at-home colon cancer screening test. The best part, it requires no prep. A colonoscopy and Cologuard provide different information and are both effective tests for detecting colon cancer. However, a colonoscopy is still the gold standard for colon cancer screening. Colonoscopies require more bowel prep work, where the colon has to be completely emptied before the test. It's the only exam where your doctor can visualize your entire colon, therefore making it more accurate. Dr. Humberto Aguilar is a board-certified gastroenterologist with gastrointestinal specialists.
The screening in Louisiana is in the lowest, one of the lowest in the country. The ideal is to get at least 75% of the potential patients to get a screen, and we are way below 60% here.
Cologuard is an FDA-approved test for individuals who avoid colonoscopies due to the prep. It's an at-home test where the patient collects a stool sample and it is then shipped to a lab to be examined for abnormalities.
Cologuard tests the stool for blood and also check some particles of the DNA that is important component of our genetic material that is shed into the stools. Cologuard can identify up to 94% of all the colon cancers. But sadly only identify about 50% of all the colon polyps.
However, individuals who have a history of polyps, family history of colon cancer, inflammatory bowel disease, or other adverse gastrointestinal symptoms are recommended to have a colonoscopy and not participate in Cologuard.
We believe, and we are seeing now, that patients that are unwilling to do a colonoscopy and unwilling to drink the prep get a Cologuard, and with the Cologuard being positive, they are afraid that this could be colon cancer, and they come for colonoscopy.
Dr. Aguilar says that Cologuard is a great test, but about 15 to 20% of patients have false positives, meaning they have a positive test, but they don't have colon cancer or presence of colon polyps. It's important to note that every positive Cologuard test will need to be followed by a colonoscopy. The current recommended age for colon cancer screening with no previous risk factors is 45 years old.
If you have a family history, you should have a colonoscopy 10 years younger than the index case, and what's recommended for patients with family history is to proceed with a colonoscopy.
Cologuard is a great alternative for colon cancer screening for certain patients who meet specific guidelines, unable to take the prep, unwilling to take the prep, or are afraid of doing a colonoscopy. For more information on at-home colon cancer screening, just visit our website at ktbs.com/health.